Melissa, and I'll be your nurse today.
Okay.
Just going to provide some hand hygiene and give us some privacy. Can you just state your name and date of birth for me?
Katie Rogers, 5401.
All right, perfect. So the doctor's ordered for a complete head-to-toe assessment, and it's going to require me to touch you. Is that okay? All right, perfect. So I'm going to start off with a series of questions. Can you state your name again?
Katie Rogers.
Okay, and do you know where you are?
At Middle Georgia Clinic.
Okay, and do you know why you're here?
To get a head-to-toe assessment.
Okay, and who's the president?
Trump.
All right, so my patient is oriented ×4. You haven't had any head trauma, correct? All right, if my patient did have head trauma or a brain injury, we would do the Glasgow Coma scale. I don't know if you can see. And that's a 15-point metric, and it measures your visual openness, your motor skills, and your speech, which are all intact. So going to move on to, first off, general inspection. I'm noticing my patient is alert, oriented, dressed appropriately, is well groomed. I'm going to go ahead and assess your skin tone. And it goes back immediately. So my patient's skin is appropriate for her ethnicity. Her hair is clean. I don't see any head lice or balding or anything like that. So I'm going to move on to your head. So your head is normocephalic, and it's appropriate symmetrically for your body. And yeah, I'm just going to feel you right here. No bumps, lesions, abrasions. Do you feel any tenderness?
No.
Okay. Do you ever get headaches?
Not really.
Okay, and moving on to your ears. Your ears are average size for your face. And the top of the ear is midline with the outer canthus. Do you experience any hearing issues? Okay, if my patient did have any hearing issues, I would do the whisper test. I would close one ear and I would whisper 3 words. So we're going to go ahead and do that.
LEC.
That works. And I would do the same thing for the other side as well. But my patient's hearing is intact. And moving on to your eyes, I'm going to use Perla, which is pupils are equally round and reactive to light and accommodation. So looking at your eyes, they're about 4 millimeters. So that's good. They're nice and round. I'm going to just shine the light if you'll look straight ahead for me. All right, pupils are directly constrictive and consensually restrictive. Do the same thing for the other side. All right, so bilaterally they are both constrictive and consensual. If you'll just follow my pen light. All right, and her eyes are equally reactive to light and accommodation. So moving on to your nose is midline with your face. I don't see any abrasions or anything. If you'll just close one nostril and breathe in. Do the other side. All right, no patency issues. I'm going to move on to the mouth. If you'll just say ah. All right, oral mucosa is pink, moist, and shiny, and her teeth are hygienic. I don't see any lesions in her mouth. And do you have any difficulty swallowing?
No.
Okay, if you'll just swallow for me. Okay, trachea is midline. So moving on to the musculoskeletal, I'll just have you sit right here. Actually, I'm going to have you stand up, and I'm going to assess your gait. So if you'll just walk towards me.
Okay.
All right, gait is intact. And I'm going to also do a balance test. So we have 2. Your gait is intact. Perfect. So now we're going to do a balance test. We have the tandem, which is heel to toe, or we have the Romberg. So just close your eyes. I'm going to watch it for 20 seconds. No unusual swaying. Go ahead and sit down. Just on the edge of the bed is fine. Okay, and do you have any major joint discomfort or any major surgeries I should know about? All right, perfect. So I'm just going to assess 2 of your upper extremities. I'm going to do your elbow. So I've got the elbow in my hand. Go ahead and flex up, put your fingertips to your shoulder. Good. And back down. No popping or crepitus noted. And I'm going to try some resistance. Go ahead. Okay, and down. Perfect. And we're going to go ahead and do your wrist. So go ahead. Flex down, extend up, and hyperextend. Okay, no popping or crepitus noted. Now resist. All right, strength is good. Now we're going to do the same thing for the other side. And go ahead and go up. No popping or crepitus noted, and resist. Down. Perfect. Same thing for your wrist. Down, up, and hyperextend. All right, no popping or crepitus. And resist me. And up. Perfect. Now I'm going to do your knees. So go ahead and I want you to flex back like this and then extend out. All right, no popping or crepitus. Now resist. Go back and forward. Perfect. And I'm going to go ahead and do your foot too. So I've got your ankle in my hand. Now go ahead and go down dorsiflex up, no popping or crepitus, resist, resist, perfect, strength is good. Last joint, all right, no popping or crepitus, okay, and now resist me. All right, strength is good, and your foot. One more time. Perfect, no popping or crepitus, and resist, strength is good. So you can go ahead and lay back down for me. All right, so now I'm going to do your cardiac and respiratory. Do you have any shortness of breath? Okay. Fix this. And do you have any chest pain? Okay. So are you experiencing a cough or any mucus or sputum? Okay. Well, if you were, there's a couple of things that you could do. So if you're bedbound, you would do the turn and cough method. And you're going to take a deep breath in, exhale, turn, and cough. You're going to do that for both sides. And then you have the incentive spirometer, and you're going to breathe into the device, form a tight seal around the mouth, inhale, hold your breath for about 3 to 5 seconds, and then exhale. You understand? Perfect. All right, so I'm just going to listen to your lungs. And I'm on direct skin, and I'm using the diaphragm side of my stethoscope, starting in the right upper lobe, left upper lobe, left lower lobe, and right middle lobe. All right, can you just cross your arms for me? I'm going to listen to the left or right lateral lobe. And the left lateral lobe. Perfect. And go ahead and left upper lobe, right upper lobe, right lower lobe, and left lower lobe. All right, and just keep breathing normally. All right, and I got my patient's respiratory rate at 13 beats per minute. It was unlabored and euthanasia. All right, so moving on to the cardiac assessment, I'm just going to feel for edema, starting in the lower extremities. No pitting or edema, hands, arms, no pitting or edema. And I'm going to go ahead and feel her temperature, which is nice and warm, nothing abnormal about that. And I'm going to go ahead and do your pulses, so if you'll flip over. Do your radial pulses, 2+ bilaterally, and then your posterior tibial, 2+ bilaterally, and then on top of the foot, the dorsalis pedis, 2+ bilaterally. And you have some other sites. You have the carotid, you have the axillary, you have the brachial, you have the femoral, and the popliteal behind the knee. I'm going to go ahead and assess your capillary refill. Alright, and it comes back within 3 seconds, so your perfusion is good. I'm going to go ahead and do the nail hygiene. Your nails are good, they have a nice round shape, they're pink in color, and look great. So now I'm just going to listen to your heart, starting on the right side of the chest. On the second intercostal space, using my diaphragm. And this is the aortic valve. Moving to the second intercostal space on the left side, the pulmonic valve. Third intercostal space is Erb's point. Fourth intercostal space is the tricuspid valve. And then the fifth intercostal space, just mid-clavicular, is her mitral valve or her abdominal where I'd listen for a full minute. So now I'm going to have you lay down a little bit. It's going down. We're going to move on to your GI assessment. Okay? I'm going to show you mine. All right, you don't have to lift up your shirt, but I'm going to pretend for video purposes I'm inspecting. No hernias, no scarring, no lesions. I don't see anything abnormal. When was your last bowel movement? Okay, and any flatus? Yes? Okay. Now when you eat certain foods, do you have any discomfort? Okay, good. So I'm just going to listen to your bowel sounds, starting in the right lower quadrant. Moving to the right upper quadrant. Moving to the left upper quadrant and the right lower quadrant. All right, and bowels are normoactive, and I would use the L side. I'm gonna go ahead and do that. To listen for the triple A, which is the abdominal aortic aneurysm, or any bruits or whooshing, which I don't hear. And by the way, for the heart, I heard all S1 and S2, they were present, and the bell is for murmurs or S3 and S4. So now the last system is your urinary. You want to make your last menstrual cycle.
Last month.
Okay, and last time you went to the restroom to go urinate, was anything unusual about it? Any foul odor, discharge, anything like that? Right, so I think that concludes our assessment. I am going to take a little look at a blank sheet really quick. Make sure I covered everything. I'm at 11 minutes, so. Alright, so number one, I'm going to have to palpate you. Tell me if you feel any tenderness in all four quadrants. Alright, and I'm going to look for some jugular vein distension. I'm not sure if I did that. Other side. Alright, perfect. So now I think we're done here. I'll send the doctor in, okay?
Okay.
You've been a great patient.
Have a good day.
Thank you.